All right, everyone. Welcome to my YouTube video channel today. Today's topic is why do you have a bad breath? Sometimes we can call it stinky breath. So let's talk about the reason most people are concerned. Some of you gonna have a party, gonna have a wedding, a birthday party, but you worry about your stinky bad breath, and you have a hard time to understand the reason why. Some of you brush your teeth, some of you floss your teeth, some of you uh, go to a dentist, but why you still have a bad breath? This is a million dollar question, isn't it? So let's jump right in. Let's me go ahead and do this presentation, explain to you everything about you need to know about the reason why you have a stinky breath. So before we do this, I want to congratulate the Global Summit Academy. This is the those of you who are dentists in dentistry medical field. We have the Global Summit AI and Health in Medical and Dental AI Conference in July 2026, July 27 to 28. 2 day in London, England, and it's a 40 continuing education units. I hope you can scan the QR code and join us. And those of you who are interested in sponsor uh, the event, this is a QR code. We'd love to see all of you guys who are in dentistry and medical to join us. So this is just a part of my introduction to give you guys, some of you guys are interested in dentistry, contribute to dentistry and medical. Uh, Artificial intelligence are the next step that we need to follow up. So, again, this is the uh, quick announcement. June 2026. What day? June 27 to 28. 2 day. Hope to see you there. Now let's jump right in. The most common cause of bad breath is go back to poor oral hygiene. Sometimes you're not brushing thoroughly. Sometimes you left food behind, and the bacteria decompose, produce sulfur, gas, rotten egg smell, bad. Another thing consider is uh, you not cleaning your tongue, and the is the best place for the bacteria to harbor, and it's going to grow overnight, and it's going to have a very stinky breath. So this is a picture of someone not clean their tongue. Brush your teeth properly. You can have plaque buildup like this. You gotta, and then if you don't use the floss, you're gonna have a problem with a lot of food stuck in between your teeth. That causes a bad breath. So this is the most common one. If you were to want to finish the presentation, if you're a healthy person, this is what you need to know. Brush, not good enough. Brush, clean your tongue, and floss. So the next one is gum disease, gingivitis. Gum disease called periodontitis, and gingivitis is the beginning of your gum disease. And tooth decay are those are bacteria that can contribute to your bad breath. So gingivitis or cavity, gum disease, those bacteria in your mouth will cause a significant bad breath because each of these bacteria cause different problem, tooth decay, gingivitis, gum disease. So we gotta make sure that you see the dentist. Even you see if you brush and floss and do all of that, you still need to see a dentist because some of the part of your teeth you will not be able to clean it. That's why it stings. That's why you need to see the dentist. We use the mechanical instrument to take it out, take out the bacteria, take out that's harder for you. The third one is dry mouth. If you have dry mouth, that means that you have the problem, because dry mouth can come from lack of drinking of water. Um, you might take in some antihistamine medication, or you might have other medical problem that you take for a long, long time. You will develop a dry mouth, and the dry mouth will also help to create the bacteria grow, certain type of bacteria grow in the environment of dry oxygen environment. So the four things is food with strong or other foods like garlic, onion, curry, fish sauce, alcohol, coffee can also have a temporary bad breath, because these have smell, right? Make sure you brush, floss, rinse your mouth many, many times. So food gets stuck, develop inside your mouth. These food will really cause stinky mouth, temporary, in a few hours. The fifth one is smoking. If you are a smoker, if you're a smoker and you don't brush your teeth, you cause dry mouth, lead to gum inflammation, and the smell of the smoke lingering for a long, long time. Brush, floss, and use mouthwash when you really are a smoker. Not to mention that smoking can cause oral cancer and lung cancer. Systemic disease, such as sinusitis, pharyngitis, tonsillitis, like this one, and GERD, acid reflux, or diabetes. These are the problem that will contribute. So this is diabetes. You check your sugar. If you got sugar too high, you risk of ketone um, develop and it smell. And you might have severe kidney or liver disease. Also can have a distinguished bad breath. So these are severe systemic medical problems. So when you see the dentist, you not only we're not only looking at your teeth, but we're talking about medical problems, and we have to address it. Because if you cannot take care of your GERD, cannot take care of tonsillitis, cannot take care of sinus problem, then it will develop to bad breath, and bad breath means you don't control your medical condition well. So important for you to understand that teeth are not the only reason why you have a stinky bad breath. You need to see a dentist. So how to prevent these bad breath? You gotta brush, you gotta floss, use a tongue brush to clean it out, and floss, and also use mouth rinse. I'm not recommend any kind of mouth rinse in this one here. You need to go to the either the website, or you follow the American Dental Association recommendation, any of those ADA approval mouth rinse, you can use them. Some of you guys refer certain non-alcohol mouth rinse, some of you guys refer alcohol mouth rinse, and each of them have different advantages, disadvantages. This is enough to say you got to try and use it. Again, drink enough water, brush, floss, clean your tongue, use mouth rinse, and frequently see your dentist. So important. And if you have a medical problem, you got to see ENT or endocrinologist or a doctor that specializes in certain problem that you have. So in summary, I want to summarize really quick. 90% of the cause of bad breath come from the mouth. So poor oral hygiene, gum disease, dry mouth may remain the cause due to bad breath. And other cause could be food, smoking, systemic disease. But these small percent, 10% or less, is also very serious. It means that not only when you don't have medical problem or dental problem, you may have medical problem. So it's a serious problem. I hope that you enjoy this quick video, and I'll see you next time. Thank you for watching. If you like this, please don't forget to subscribe. Bye-bye.